How are you guys? My name is Tavian,
And I'm Erica.
and we're with the UNC School of Dentistry. Go Tar Heels!
Let's go Hills. So today we're here to tell you basically a little bit about the study of periodontics. So perio is basically everything surrounding your teeth. So that's gums, that's bones, and that's also what we call the periodontium.
So first we want to tell you a little bit about gingivitis versus periodontitis. Gingivitis is inflammation of your gums. So if you're not brushing your teeth, if you have a lot of plaque buildup, you get a lot of germs in your mouth, and your gums become inflamed, which means they become red, they may hurt a little bit, you may have some pain there. So that's not considered periodontitis or perio disease. When we talk about periodontitis, we're talking about inflammation but with bone loss. So gingivitis is just going to be with your gums, the soft pink tissue, and periodontitis is going to be a deeper inflammation that includes the bone as well. And that's what periodontists are going to focus on. They're going to focus on the periodontitis. General dentists are generally going to focus on your gingivitis.
All right, so along with periodontitis, periodontists will also be doing things to help heal your gums. So they would do periodontal surgery. They have non-surgical and surgical surgeries that they can do to pretty much make your gums, your bone, and everything surrounding it a lot healthier. They also do implants. They do extractions. Anything that's pretty much considered kind of surgical, periodontists can handle.
And periodontists, they can even do what's called IV sedation for some of their procedures. And what that means is that they put you sort of to sleep. You're not all the way asleep, but you're kind of woozy and you don't feel the pain as much. So they call that IV sedation. If you ever hear that word, just know it means they're putting you almost to sleep so that they can do the surgery without you feeling it and without feeling any pain. So that's pretty cool.
Exactly. All right, so then we go into basically how do you become a periodontist, and what does a periodontist differ from an actual general dentist? So everyone goes through 4 years of dental school to just be a regular general dentist, and then if you want to go and do something else like perio to be a periodontist, you would do an additional 3 years of school, and that's where you learn all of your surgical techniques. You learn how to put people to sleep and do IV sedation. You learn how to do surgical extractions. You learn how to do things like gingivectomies and everything kind of surgical, maybe even a little aesthetic during those 3 years of residency, along with a lot of research as well.
Mm-hmm. And then each periodontist resident, they're required to do a thesis at the end of their residency.
Mm-hmm.
So after they do their 3 years, they'll do research which they'll present in front of a board of periodontitis. Lord have mercy.
Periodontists, yes.
In front of a board of periodontists that will approve their research. They'll see a bunch of patients in some complicated cases so that they'll be ready to pursue difficult patients when they're out practicing on their own. And once they're finished at 3 years, they can basically go anywhere and practice. Some periodontists will practice in their own office. Some may practice along with the general dentist in their office on select days. Some may choose to go into an academic setting and teach students like us in school. So there's a variety of things that periodontists can do once they graduate, not just private practice.
Absolutely.
Yeah.
So I hope you learned a lot today about what periodontists do and what periodontitis actually is. Thank you all for watching. I hope you enjoyed it.
Yes, thank you guys. And if you have any questions, feel free to reach out to us, UNC Dental School. I know you all probably have Instagram. You can follow us on UNC_SNDA and just reach out if you have any questions. Thank you guys.
Take care. Bye.